Hello everyone, this is Sapna from RPIT Medical and Technical Campus. In today's class, we are going to discuss about serous fluids collection and their preservation. So, what are serous fluids? Serous fluids are those fluids which are present in the cavity in between of serous membrane, and in serous membrane these fluid includes pleural fluid, pericardial fluid, peritoneal fluid. First of all, we will discuss about pleural fluid. Pleural fluid is present between two layers of pleura. Pleura is made up of two layers of membrane that covers the lungs and line up of the chest cavity. The area in the lungs that containing pleural fluid is called pleural cavity. Normally, there is small amount of pleural fluid is present in the pleural cavity, and that is 10 to 20 ml. Now we will discuss about the collection of pleural fluid. So first of all, patient should be directed to sit on the edge of the chair or on a bed with his head and arm resting on table. Clean the skin around the insertion site and drape the area. A local pain killing medicine is injected into the skin, which is sting a bite but only for a few seconds. The thoracic anesthesis needle is inserted above the rib into the pocket of fluid. As a fluid drained into a collection bottle, many people cough a bit as the lungs re-expand to fill the space where fluid had been. Storage. How to store this pleural fluid? Sample can be stored in a refrigerator at 4 degrees Celsius. Now we will discuss about the pericardial fluid. What is pericardial fluid and how is it collected and preserved? So the head is surrounded by the heart is surrounded by a protective membrane, the pericardium. This called normally pericardial membrane produces pericardial fluid. Pericardial fluid is the serous fluid is secreted by a serous layer of pericardial cavity. In a healthy adult, there is up to 50 ml of clear straw colored fluid. Normally, only a small amount of fluid is present because of the rates of fluid production and absorption are about the same. Functions of pericardial fluid. The fluid acts as a lubricant for the movement of heart, reduction friction as a heart pump blood. Now we will discuss about the collection of pericardial fluid. First of all, patient placed on supine position. The skin is sterilized with the help of local anesthesia. Use 3 inches 16 to 20 gauge of needle. Identify the anatomical landmark and select a site for needle insertion. Insert the needle immediately at the angle of 30 to 45 degree. Direct the needle insertion towards the left shoulder. Aspirate during insertion. Once fluid is encountered, stop advancing the needle and continue aspirating. Leave the needle in place and secure it. Reassess for improvement repeated when it is necessary. Now we will discuss about its preservation. 50 ml of pericardial fluid collected in a red or green top, which is known as heparin, for glucose estimation. A lavender top EDTA tube for cell count. Sterile container for microbiology tests. 200 to 250 ml of fluid in a clear container for cytology. Now we will discuss about peritoneal fluid. Peritoneal fluid is a liquid made in abdominal cavity. Normally, peritoneal fluid is produced by mesothelial cells in the peritoneum. In a healthy adults, there is up to 50 ml of clear straw-colored fluid. It covers most of the intra-abdominal organ, and increased volume of peritoneal fluid is called ascitic. It is also known as ascitic fluid. Now we will discuss about synovial fluid. Synovial fluid, also known as joint fluid, is a thick liquid located between your joints. The fluid cushions the ends of bones and reduces friction. A synovial fluid analysis is used to help diagnose the cause of joints and secreted into the joint cavity. Now we will discuss about the functions of the synovial joint. The synovial joint acts as a lubricant for movement of joint, reduction friction during joint movement, absorbing shock, supply oxygen and nutrients, remove metabolic wastes and carbon dioxide from chondrocytes. Now we will discuss about the collection of synovial joint fluid. So synovial fluid is collected by syringe in a procedure termed as erythrocentesis, also known as joint aspiration. The fluid is sent to lab for analysis. Now we will discuss about the storage of synovial fluid. The specimen of synovial fluid is stored with anticoagulant EDT or heparin and without anticoagulant at 4 degrees Celsius before examination. Seminal fluid. Now we will discuss about the seminal fluid. The seminal fluid is an inorganic fluid that may contain spermatozoa. It is secreted by sexual organ of male and can fertilize female ova. Seminal fluid is also known as semen. Purpose of this test is to check the investigation of fertility, identify treatment for options, determine the susceptibility of semen for artificial insemination or IVF. Sample collection. The patient should be instructed to collect semen after 3 days of sexual absence. 2 separate samples at least 7 days apart should be analyzed. The duration of absence should be constant. Pre-warmed 121 degrees Celsius sterile non-toxic wide mouth container is used for the sample collection. Now we will discuss about the precautions. Wash the hand with soap and let them dry. Gland and penis should be cleaned with a wet paper towel. Keep the sample at body temperature, not in sunlight. Thank you.